All right, it looks good now. So, last week we studied about malfunction of the devices. That means what happens when there is a problem in the devices, right? Let's a little bit. It's a simple one. I'm going to review one more time. Equipment malfunction. So among this, if you check, like here's understanding equipment malfunction and different types of equipments like ECG, EOG, EMG wires. It's talking about wires, electrodes, right? And if the electrodes are bad or poorly applied, then it's going to give us like different types of artifact. And we cannot, rely on the accuracy of the recording at that time. We have to make sure that they are applied correctly, and we need to make sure that the wires are good. Another thing is pulse ox. You know about pulse ox. So pulse ox supposed to be working good. If it is not working good, it will be on and off, or it will read wrong, because pulse ox reading is supposed to be 90 to 100, or if it is normal, it should be 90 to 100. But sometimes if it is reading 110, 200, or sometimes 0, sometimes exactly 100, there may be malfunction. Same way, airflow sensors, like the airflow sensors mean the nasal cannulas and chest belt, abdominal belt, like those kind of belts are, if they are not working good or they are not applied correctly, they're gonna flow everywhere. So we have to be careful on that too. Respiratory effort belts, that's the one. ECG, EKG, that goes. ECG, EKG will go on right here on our both side, and we have to make sure that they are working good too. Now this is very simple, like if it is working or not working, and if it is not working, then we have to make sure like it is working, because we will know. If it is not working, then it will not give a normal waves. So the most important thing is we need to know what is normal wave look like, okay? The normal waves look like. So we need to know if it is ECG, it's supposed to PQ REST wave. So if it is respiratory, it should go like wavy like that. And we need to know what is the normal wave look like. Okay, so the other thing is, when we study the chapters, almost every chapter goes to related to each other, and it would be so difficult sometimes. You may be feeling like it seems same to me. Have you realized that way?
Yeah,
Yeah, it seems like same. I don't know what is new in this chapter. Just like it says CPAP, BiPAP, like on this chapter, if you see here, the audio video equipment malfunction, if not working, computer software not working, this is the devices and how to do the troubleshooting. That was for equipment malfunction. And today we're going to check about domain 1, task D, physiologic and clinical events. This one, physiologic, clinical events. Now the first thing is respiratory events. Respiratory events. Okay, I wanted to go today through the book. Okay, let's check the book first. All right. turn the page number, chapter 13. Okay, chapter 13, page number 188. So the good thing about polysomnography, we will be studying just same thing, different in different ways. That's how it goes, and that's why it will be sometimes it's confusing. Now here it says like abnormal events, because we are studying about the events. Here our chapter is called respiratory event. Our chapter is hello. I put it. Okay. So here it says like abnormal events in chapter 13. But our chapter that we are studying is like physiologic clinical events. So what kind of events we can see in the chapter? What kind of events we can see? Events means when we do the sleep study, when we are running sleep study, what kind of events we see. Events means all the physiologic activities that we can see. The first thing here, according to the book, if we go according to the book, this one on the canvas, its first thing is respiratory events. But if we go over here in the book, page number 188, it tells about EEG arousal. EEG arousal, okay? I want to open like a real study, and then it makes it easier for us. And I want to show you what EEG arousal look like. Okay. Do you have any idea what is arousal mean?
No.
Okay. Arousal mean when somebody is sleeping. After he falls asleep, if he is awake, or he's just woke up like disturbed in sleep, at least 3 seconds, then that is called arousal. All right. Okay, let's check on this. We're checking the arousal. Okay, look at this. At the top you see that's awake, right? WK, wake. Patient is awake, and patient is awake right now. Now when we see here, patient is awake, then goes to stage 1, stage 2. Now patient is in stage 2. You see, patient is in stage 2. If this is the previous epoch, this is called epoch, and in this 30-second epoch, he's in stage 2. But what happens next? In next, you see this one. So this is called arousal, because patient was sleeping pretty good. Suddenly he wake up here. His sleep is disturbed at least 3 seconds. If you count from here to here, it is more than 3 seconds. So this is called arousal. Okay, this is called arousal. And this one, if you check here, this is arousal. Okay, now let's go check another one. Now patient is sleeping, and patient is sleeping here, but here patient suddenly arousal, like he wake up. Patient wake up here, right? And now patient is sleeping again. So this is, I know this is a little bit difficult. Let me open maybe another patient's name. I'm trying to open a little bit better if I can find a clean study. I'm thinking like everything looks same, zigzag, zigzag, zigzag. What is arousal, what is sleep is so difficult. Now you'll understand this one is better. This one is better. Okay, let's go. We're trying to know the physiological events, right? So you see here, patient is in stage 2. Sleeping. Patient is sleeping pretty good. Patient is sleeping pretty good. Sleeping, and now he's sleeping pretty good. Now no arousal at all. Patient is sleeping pretty good now. Okay, we will find out when patient wakes up. Actually, patient is sleeping in stage 2, deeper sleep. Then go, oh my goodness. Patient is sleeping pretty good. Okay, from here, yeah, here. You see, patient was sleeping, very nice, fine type of wave. Suddenly it gets darker. That means here is the disturbance in the sleep. And this disturbance is longer than 3 seconds. This sleep disturbance is longer than 3 seconds. So this is called arousal. Make sense? When patient is sleeping, and suddenly here patient was sleeping, no arousal, no dark wave, no alpha here. Patient is sleeping pretty good, no alpha. It looks same. Everything looks same, pretty good. And now here patient woke up. So starting point where patient wakes up, that point is called arousal. Okay, now patient is sleeping again. And whenever this one looks like disturbed, but it is not disturbed. Okay, you can consider, sometimes people consider this is arousal also, but this is little bit but this is not. We will see. Look, this is REM sleep, right?
Yeah.
Okay, tell me when there is arousal. Patient is sleeping pretty good. Yeah, now?
Arousal.
Yeah, here is arousal. This is from here, right? This is called arousal. So we mark it as arousal. Anything abrupt or the wave is, if we see alpha, let's say if we see alpha for 3 seconds or more. Now here alpha is 3 seconds or more suddenly, then this is called arousal. Now patient is awake, and then stage 1, and now patient is sleeping, and this one looks like arousal. Here look, this one, the technician, he said this is arousal. This one can be arousal too. If this is more than 3 seconds, this is arousal too. You see, this one is good, right? Sleeping. Spindle, you see spindles?
Yes.
Okay, this is spindle. Now this is arousal. And the patient is sleeping good now here. And here, no arousal. Patient is sleeping good, right? we see spindle, we see spindles. Now check spindles. Okay, now let's check in the book. After EEG arousal, there is another blue bold letter. It says like beta spindle. Beta spindle. Do you see that?
Yes.
Beta spindle. And it says like frequency greater than 14 Hz. Beta spindles are fastest EEG wave. Beta spindles are most often present in patients on certain classes of drug, including benzodiazepine and barbiturates. And patients who experience chronic pain, they're also seen in patients with fibromyalgia and Parkinson's disease. Okay. So beta spindles. What is beta spindle? To understand the beta spindle, we need to understand the spindle. Now here, if you see, this one is a spindle, right? This one is a spindle. But this spindle, when it becomes more, like, I would say this one is beta spindle, because spindle are small. These are bigger. From here to here is pretty big. This one is pretty big. So I would say this is beta spindle. Look, this looks like alpha. Beta spindles are bigger spindles. Okay, sleep spindle. Okay, here's arousal again. This is arousal. This is arousal. And now patient is wake up. Patient is wake up here because all alpha waves, zigzags only. Now here is little bit this side, no alpha. This here is alpha. So what we do is, like, whenever we see alpha more than 3 seconds, that is called arousal. This is arousal. Okay, see, from here to here is all alpha, and from this onward alpha is disappearing. If we go to the next one, there is no alpha, but from here is arousal. Can you figure out, is your eyes seeing this one? Do you see the difference between this wave and this wave?
Yeah.
Yeah, because this is alpha waves, big alpha waves. This one is beta waves, mixed frequency wave, and low amplitude. Low amplitude means the height is low. This height is high, right? Bigger. And low amplitude. Okay. Maybe I should show you on the whiteboard. So in that way, we need to see and differentiate. We have to be able to differentiate it. Now check this out. This is the way. Now in this thing, this is alpha, right? This is alpha. So, and this alpha disappear like this. This is called mixed frequency wave, beta waves normally, beta, theta, all this. And same kind of wave, like this big wave, amplitude is big, this is big wave from here to here. But this one is small from here to here, the height. So this is arousal. This is arousal. Okay, now this is sleep. Because this is low voltage, this is called high voltage, high amplitude. Let's say amplitude, high amplitude, that means this big one. This is low amplitude. This is low amplitude. So this is sleep, this is arousal. Okay, now let's go check another one. Now here on this wave, what happened is this part went sleep. This is sleep, low voltage, low amplitude wave, and suddenly it became big. That means this is alpha wave. So this is wake. This is wake. And now if I show you on this one was like this. Like this. This means sleep. But suddenly it goes big. Big and darker. Like this. Then this distance minimum supposed to be 3 seconds. If this distance is minimum 3 seconds, then this is arousal. Okay? This is arousal. Now let's check on this one. Now you can see the difference, right? Here and here. Okay. Now let's go here. Now this one, this side is low voltage wave. You see this is spindle. This is spindle. This is the good spindle. But this one is bigger spindle. But here the high voltage wave. You may be thinking maybe this is arousal. But we will count from here to here. It says like 1.5 centimeter. This is 1.5 seconds. So if this is 1.5 second, then this is not arousal. Because it has to be 3 seconds. Minimum 3 seconds. Okay, minimum this one's supposed to be 3 seconds. If it is 3 seconds, then arousal. Let's talk about beta spindle. Beta spindle. Beta spindles. Because this is sleep. Okay, this is sleep. Okay. Now this is called spindle. Spindle. But sometimes you will see like this big. Patient is still sleeping. No problem. But this spindle is little bit bigger. This is also a spindle, but this spindle is called beta spindle. Okay? And this is, this is kind of like common. It may be seen in the patient. Normally, when the patient is in medication, when patient is taking medication, and when patient is in pain, when patient is having pain because of some reason, and patient with the fibromyalgia, fibromyalgia is some kind of medical condition, or Parkinson disease. Then we see this beta spindle. Alright, let's turn to the next page. Okay, next page. Like here, all kind of pictures you can see, and in this picture, like 13.2 is a beta spindle is shown over there. Arousal is shown. Okay, now next one comes nocturnal seizure. This is called seizure. It's called seizure. Nocturnal seizure. Nocturnal seizure means at night. Whenever we see seizure activity at night. In Nepal we call it mirgi. You know, when people suddenly fell down and go like starting like, you know, feather leather from the vomiting, something like that, and then they cannot talk, they may bite their tongue, those kind of yeah, episode is
It's kind of
yeah, epileptic, yeah, that's called seizure. Yeah. So now here, what seizure look like? Because here I don't think that I have seizure montage, but let's check in our book, page number 191. When the patient has nocturnal seizure, the wave look like this. It happens only in EEG, EMG, and ECG. Not ECG, but EMG and EEG channel. You see that arousal type of 60s artifact kind of wave we can see. You know, certainly if we see that only in EMG and EEG channel, then that can be seizure. Okay. All right, let me give you an example here. You see here, in this picture, it's happening only in EEG and EMG, EOG, EOG and EMG. This happens only here. This could be seizure, epileptic seizure. Okay, but like could be, because like this one too. Everything looks good only in the EEG. Okay, I don't see EEG, yeah, I mean seizure over here, but normally seizure look like this, dark waves. Okay. And in that way we will know what seizure look like. Okay, till now what are we studying? We are studying about physiologic or clinical event. That means when we run the sleep study, what we see on the screen, what we see during the sleep study, what kind of activities we see. The first one, we saw like arousal, we saw like beta spindle, and we also here it says like seizure. Now we'll go next one in the book is leg movement. Leg movement. Okay, in this channel, all right, this is called leg 1. Look, This one is leg 2 and this one is leg 1, right? Leg 2, here is the movement, so it is called leg movement. Here leg movement, here leg movement. This one is leg movement, leg movement. Okay, here is leg movement, this is leg movement. So this is leg movement, you see. This one is leg movement. Because when leg movement is this, but like when the patient is awake, that is not considered to be any problem. Okay, that is not a problem. But when patient is sleeping, at that time that leg movement is problem. Now you see, no leg movement, right? No leg movement, no arousal, no beta spindle, no seizure. If we keep going, here may be little bit small leg movement, and no arousal, no beta spindle, no leg movement. Here no arousal, no spindle, no leg movement. So we can keep going like this. So this patient is sleeping pretty good. Now from here arousal begin. You can mark like this. I think you cannot see that. Okay, this is arousal. So you can mark it like arousal. This is arousal. Okay. So in the sleep world, like sleep, arousal, when somebody is sleeping, suddenly wakes up, the starting point to 3 seconds, it can go up to 15 seconds. That is called arousal. And we you know what kind of thing that we see during the sleep study, what kind of activities we see, that is called the clinical event. Those are called the physiological event. If you check page number 192, okay, 192, the first picture, top one is arousal and bottom one is leg movement, right? Top one, it is circled in the picture called EEG arousal. The bottom is shows leg movement. So that kind of thing happens, leg movement. And next picture 13.6 is a spindle. All these three have spindle, pretty good spindle. Okay, now next physiologic event is leg movement. And I showed you before what leg movement look like. Look, this is leg movement. Okay, this is leg movement. There is no leg movement and suddenly leg movement is here. This is leg movement. Do you see that? Here is no leg movement. Leg 1, leg 2 channel. If you go here, here is leg movement. 1 and 2, both legs. But patient is awake. We do not consider is that a problem. We consider that leg movement problem when patient is sleeping. When patient is awake, we don't consider that's a problem. Alright, now we will go to the next one, is bruxism, page number 196. Bruxism is biting down constantly. When patient bites down, whenever he bites down his teeth, and we can see the artifact problem. Okay, in this picture you can see. Page number 198. Page number 198, 199. If you see here dark waves that goes to the EEG, EOG, chin and ECG channel, this is called bruxism. In this real data, these are the bruxism. Patient biting down or eating something. Okay. Yeah, this is biting down, okay? That's called bruxism. Okay. Do you have any question?
So, beta arousal, those right?
Yeah, beta spindles are a bigger spindle, which wave is more than 14 Hz. They seem like spindles, but they are bigger one.
And arousal is more than 3 seconds.
And what is bruxism?
Grinding.
Yeah, grinding teeth is called bruxism. And how do we see? How can we distinguish? And you can see in the picture, it goes dark waves, actually like this.
So grinding is we recognize hook up.
Yes, by chin, right. That's the EMG channel.
Yeah.
Chin, EMG. But we can see that kind of like dark waves in all the channel though. EEG, EMG, EOG, all the channel.
Oh.
Because when he bites like that, you see in page number 98, 198. Yeah, like dark waves. Yeah, so every time the patient bites, it looks like this. So when patient is eating during his sleep study, when patient is eating, then it comes like that. Okay.
Wake is right.
Mm-hmm.
When patient wake, it comes like that.
Right. When patient is eating something, then the waves look like gz, 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 like that. Every time he bites the. So in that way, these are the physiologic events. There's more. There's so many physiologic events. We need to know when we are looking at the polysomnography. What is this? What is this? What is this? We need to know all those. What is. Now here, what is this? This is movement. What is this? Leg movement. This is leg movement. People may ask you, what is this? All zigzags. Oh, this is alpha wave. And this one? This one is movement. What is this? This one is movement. Patient is awake. And this one, this is leg movement. You see leg 1, leg 2, leg movement. So every time you see like this kind of wave, that's a movement problem. Okay, here it seems like maybe bruxism. Here 1, 2, 3, 4, 5, 6, 7, 8, 9, like this. Looks like maybe patient is eating. Okay.